A vestibular schwannoma is defined as a typically slow-growing tumor that forms from the hearing and balance nerves which supply the inner ear. The tumor develops from an overproduction of Schwann cells. Schwann cells usually wrap around nerve fibers to assist in insulating and supporting nerves. As the tumor grows, it usually causes unilateral or asymmetric hearing loss and dizziness or loss of balance because of the way it affects the hearing and balance nerves. The trigeminal nerve, which deals with face sensation, may also be affected as the tumor grows, causing facial numbness or paralysis on the side of the tumor. It can even get large enough to become life-threatening by pressing against nearby brain structures. Some differential diagnoses for vestibular schwannoma include meningioma, epidermoid metastasis, and ependymoma. Meningioma are extraaxial tumors, and they are usually more homogeneous in appearance compared to vestibular schwannomas. Epidermoid cysts are relatively common congenital lesions that have no enhancing component. Brain metastases are cancer cells that have spread to the brain from tumors in other parts of the body. However, they are very uncommon and usually do not alter the internal auditory canal. Ependymomas are glial tumors, often arising from the ventricles of the brain or the central canal of the spinal cord. They usually occur in younger patients and are centered on the fourth ventricle. They also do not extend into the internal auditory canal. Since vestibular schwannomas generally occur unilaterally, that is, on only one side or one ear, symptoms tend to present themselves asymmetrically. Once a patient makes their doctor or audiologist aware of their symptoms, including dizziness, ringing in the ear, loss of balance, the assessments will begin to narrow to see if vestibular schwannoma is the cause. After initial audiometric testing to gain knowledge of the patient's pure tone threshold and identify any airborne gaps, the patient will undergo an MRI to identify any tumor that may be present. If the MRI shows evidence of a tumor, a surgical removal procedure is considered. Shown here are audiograms representing left ear sensory neural hearing loss due to vestibular schwannoma. It is important to remove a tumor to maintain normal function, but there are risks of damaging the nerves if the surgery is not successful. One type of surgery is stereotactic radiotherapy, which can target the tumor more closely if it has defined boundaries. While it is an innovative procedure, it can be costly and is not widely available due to required specialized equipment. The effects this tumor has on the vestibular and facial nerves requires rehabilitation post-surgery to improve vestibular functions like balance and posture. There are various rehab methods. Vestibular rehabilitation therapy, or VRT, includes practice with head and eye movement coordination with body movements, reducing dependence on balance stabilizers. Overall, the most common and successful treatments involve removal of the tumor and post-surgery rehabilitation therapy to improve the damaged vestibular functioning that resulted from the tumor growth.